buy drinks.
No, I think I'm good. Do you want ice water?
Yeah, I do.
I'll bring it for you.
Hi, sorry, do you guys want to start sitting?
You know what? Can we get some ice water?
Ice water? I'll get that. Yeah, no problem. I'll bring it.
We good.
No problem.
Go, ladies.
Oh, is it? Okay.
I'll stand back here.
Let's show him on
Do you think I could get some ice water for the 4 people up front, the doctors who are going to be on camera? Sure.
Thank you. $4 get me 2 bottled waters, or is there tax on that? Yeah, 2.
Sorry. Do you think you can help me bring up the ice water to the front when I get, because I need 4 and I have to.
Did they want a bottle of water?
No, just ice water glasses. Okay.
Sorry.
I need to go get cash. Oh, she's quieter than this. I'm literally in the way of this.
We can definitely hear you too.
Thank you so much.
Enough glasses?
Yes, just, I guess.
Do you have wine?
Yep.
You got red wine?
Another red? That's fine. Another red.
2 reds and 1 white.
Sorry. Don't worry about the white. Oh, okay. Yeah, another white. Sorry.
Oh, that's too much. Hello, everyone. That's very loud. Hi everyone, welcome. If you haven't had your seats yet, please do so. We're about to begin. if you haven't met me yet. I am the writer and interviewer for Stolen Childhood. And today we have with us Dr. Alison Vanderberg, Dr. Wendy Williams, Dr. Ayla Wilson, and Jennifer Davis, Panda's mother. Wendy Edwards. Oh my God, what did I say? I'm so sorry. It's good. It's a good start to the evening. Sorry, I'm Dr. Wendy Edwards. We're here to answer your questions and give us insight. They're here to answer your questions and give us insight into pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, which is a disease that is often overlooked and rarely correctly diagnosed. We'll start with questions from you as well as questions from our live stream. And to begin, I would love if some of the doctors would like to explain what PANDAS is.
So for those of you who don't know, PANDAS is an acronym for Pediatric Autoimmune Neuropsychiatric Disorder associated with streptococcal infection, and it is an acute onset of neuropsychiatric symptoms following a strep infection. So some of the symptoms we might see would be a sudden onset of OCD, anxiety, ADHD-like symptoms, urinary frequency, urinary accidents, vocal or motor tics, emotional lability.
Sure. It happens because your body appropriately fights off the strep, but then your immune system doesn't stop fighting. And it goes looking for something else that looks similar to strep. And strep is very smart, and in an attempt to keep you infected at the beginning of the illness, it kind of presents a coating over itself to make it look like something else in the body. And this is exactly what used to happen in rheumatic fever. And the strep would make itself look like a heart valve. So when the strep was gone, the immune system would continue to attack the heart valves. Now what the strep seems to be doing or making itself look like is a part of your brain called the basal ganglia, which is in the center. So the immune system then starts fighting against your basal ganglia, and that's your center, like Dr. Wilson said, for emotion and motor control. So these children have difficulties with rages, emotionality, tics, fine motor weakness, et cetera, et cetera.
Sorry about that. If we could open up the floor to questions now from our audience. Just raise your hand and I'll come to you with a microphone. Just any questions you would have for our doctors here present who are for our expo panel. Anyone want to start us off?
So does strep affect adults as well, or is it mainly children?
Really good question. Right now, the research has been primarily on children. And when they started looking at this in like 20 years ago in 1998, they were just looking at children. So that's why it got called pediatric. But there's definitely instances now where some psychiatrists and researchers in the psychiatry area are actually looking at adult onset of things like OCD and anxiety disorders. And so it probably can and does exist in some adults. And a lot of adults, if you think about it, may have started with PANDAS way back when, got the diagnosis in the mental health field, and it's just followed them through their lives. So it could persist into adulthood. It might even start in adulthood, yes.
Just to add to that, I definitely do have a number of patients who are adults and have had an adult onset, as well as, like Dr. Edwards said, adults who have, they've been through many years of psychiatric medications for treatment of OCD or anxiety disorders that had an onset when they were a child, and so we can kind of trace back to that. I also find that the presentation varies depending on the age of the child. So you may see, like, in little kids, it looks a bit different than an adolescent onset, or teenagers and adults as well. So I may see more in the teenage population, anxiety, depression, OCD, food restriction, and in adults, anxiety, depression, chronic fatigue, like presence with other autoimmune conditions as well. Things like fibromyalgia, chronic fatigue syndrome, and other autoimmune conditions.
Is there a reason that they would present differently based on your varying ages?
I don't know, actually. I'm just thinking with some of my experience, especially with kids with Lyme, they tend to present more with like so I'm more speaking to PANS right now, but if that child has Lyme or tick-borne infection, I might see more of the PANS symptoms, whereas my adult patients may suffer from, mood issues correlated with that infection, like OCD, anxiety, depression, panic attacks, but they also tend to present more strongly with like symptoms of fatigue, joint pain, like chronic body pain, and neurologic decline.
Do we have any other questions for the audience? And I'd like to remind you that we are taking questions from our live stream as well.
Hi. I have a question about whether or not, I have two kids now who are presenting with symptoms. One has been for many years, for 5 years. This is Delphine. I don't know if they've never met before.
Yes, like introduce yourself.
Yeah, I'm Heather
Metcalf.
Metcalf. Yeah, and she's Delphine. So we've been with you for a while. And so Estelle, in the summertime, started with ticks. And it's exactly what happened with Delphine. And it was the same pattern, except the OCD came on super fast. Much different than Delphine. But how is it contagious? Like, is it something she was carrying and passed it on to her? It's just so curious that I know that there may be a genetic susceptibility there, but it's just like we both started with ticks, and then I have friends here, and their kids have never had ticks before. It's just strange how everything that they do, their symptoms are so similar, and I wonder, like, is that because it's from the same bacteria? No? Okay, and I don't want to start a worry, right? But it's just so curious. I mean, it's more than curious, but I'm just wondering.
Well, I'll say something. And that, first of all, I don't think we believe that all ticks are PANS.
Yes. Yeah.
So you can certainly have ticks. Ticks represent one of the symptoms associated with PANDAS, but it's only one thing.
It was the OCD that came on, like, with a vengeance as well.
Okay. And certainly we do know that if both children do have PANDAS, if the child comes up against someone who's infected with strep, the affected child certainly can manifest more symptoms. But why, is there a family tendency for PANDAS? I don't think we really know that yet.
We absolutely don't know if there's a family tendency, but that being said, every child who gets strep doesn't come down with PANDAS, right? So I do think there is a genetic predisposition in the way your immune system reacts to things, so that your daughters probably have similar genetics in the way that they would respond to a strep infection. And then I guess the other part is, what is the strep? The strep is the part that's contagious, right? So you can catch strep from your sibling living in the home. And there's hundreds of different kinds of strep A, and it's a certain form of the strep that seems to cause this certain immune reaction, and you have to have the genetics to have the immune reaction that overdoes it like that.
Well, while that's stuck, I can add a little bit. I usually go through like pretty deep family history with my patients, as you probably remember, and oftentimes there's quite a bit of autoimmune disease in the family that extends like to the grandparents, or even rheumatic fever in the great grandparents. So we know that like definitely sometimes it comes out of the blue and we're not expecting it in a child because there's just no autoimmune disease in the family that we know of, or nothing else like this. But there's certain genetics that would predispose your kids to developing like this type of response to strep, whereas someone else may have, they get sick, they take the antibiotic, they get better. So.
I think I might be like toxic or something to the microphone. Okay. So I think that many of our families we've spoken to have mentioned that they've homeschooled their children. So Adrian on Facebook asks, what are your thoughts on homeschooling due to the amount of stress and the risk of and the risk of being contagious? The risk of encountering a strep pathogen.
So I'm a mom to 2 boys who both have PANDAS, and I actually do homeschool them both. It was a personal choice, but at the time it felt more like it was a forced decision. Their symptoms were so bad that my youngest son actually missed so much school that he was taken off the roster. He could no longer be considered a student. Homeschooling them has been the best decision for them. I can't speak for other parents or other children, but my oldest son has made what appears to be a full recovery right now. When they were in school, they were sick and flaring nonstop, and their life it wasn't a life for a child. They were suffering more than they were enjoying their childhood. So it is stressful homeschooling. It isn't easy, and it took a while for them to figure out that I'm mom and a teacher, and not just it's not just a fun little thing that they get to stay home and do all day. But I can't say whether everybody should do it. Obviously, some children thrive in the school still. Mine did not, however. So I think it really boils down to your situation, and it's a personal choice. So.
I think the other component to think about regarding homeschooling is, some children are exposed to a lot of strep at school, and therefore they will flare and flare and flare. And that's not always the case. You might have a teacher who's a strep carrier in the worst possible situation, and so your kid's always exposed to it. Or there might be a lot of kids in that class. So sometimes the environment there can be detrimental to them because they're picking up strep or exposed to strep all the time. But one of the maybe advantages to going to school, I don't know if this is an advantage or a disadvantage, a lot of these kids work really, really hard to control what's happening to them, and they don't want their friends to see it. So when they're at school, they do relatively well, and then they get off the bus or walk in the door and they fall apart. And that's because at home, your parents love you, so you kind of let it all hang out. And sometimes going to school can be beneficial because it's a little bit of normalcy for them. They can go to school and they know that they can manage there. They try really hard and they can. Now, on the other hand, some of the older kids tell me going to school and trying so hard to manage is too stressful. So it's an individual decision for sure.
Some of the kids I treat who are in school and they do well in school, and so we don't necessarily consider homeschooling, I would have them through the school year on a prophylactic antibiotic. And this would be provided, they're the kind of kid that's in remission in the summer and things are great, and then they go back to school and they're exposed to strep in the classroom, and they're just really up and down through the school year, so they may require that. And then another option as well for kids who flare with viruses, which is just non-stop at school, obviously viral exposures, is to have them on a prophylactic antiviral. And that just keeps their immune system a bit more level while they're in school.
So I'm going to amalgamate a few questions that we've gotten from online. This is an amalgamation from Michelle, Stacy, Amber, and a few others. At what point if you wouldn't mind explaining what IVIG is, and at what point should families start to consider it as an option?
IVIG, intravenous gamma globulin, is a collection of immunoglobulins. It's a blood product, so it's a collection of immunoglobulins gathered from a whole bunch of different donations of blood. And they use it for a lot of different disorders. They use it for Kawasaki's disease, if you've ever heard of that. They use it for IDP, autoimmune type diseases where your own immune system is overreacting to things or causing damage. So they give you this infusion of a whole bunch of these immunoglobulins that are healthy and good. And the thought is, nobody's really exactly sure how this works, but the thought is that when these good ones are put into your body sees that there's a whole bunch of it going on there and turns off its own overproduction, so that your own immune system settles right down when you get the IVIG. It is a blood product, so there's a risk with that, although we have much, much better testing of our blood products than we did 20 years ago. It's pretty benign. It does require a hospital admission. You are in the hospital overnight. We give the same doses that we would use for other pediatric disorders. I try not to use it until nothing else is working. So if you're using antibiotics and you're getting response, then you're not going to be going to IVIG. But if you're using antibiotics and it only works for a short period of time and you're changing antibiotics and you're kind of chasing your tail all the time, then IVIG is definitely on the radar. And it probably takes more than just one infusion of IVIG. Certainly I've had children do it I don't think I have anybody who's done it 4 times yet. We were really close. But we've done it 3 times, and it's kind of like the 3rd time was the charm, and it finally was enough to turn that immune system off.
I concur with Dr. Edwards that it's usually used when you've had failures or children with recurrent bouts of acute flares of PANDAS, but you try to use it as a latter resort. It's quite expensive. It's a little bit more invasive, but it's certainly nice to have that as backup.
Can we have some more quiet? Oh, one over here.
Hello, my name's Deb Jacobs. My son is a patient of Dr. Edwards, but I just kind of like to get the opinion of everyone up there. I've always been a parent who's kind of believed in vaccinating my children, but now that I have one who is a panda, and we're in a better place than we were, but we are not out of the woods by any means. And I'm just really torn and looking for some input on, do we keep up with the mandatory vaccinations? What about the flu vaccination? Like, if the kid's already shown that he's going to have an overreactive immune system, are we asking for disaster by continuing to immunize at this point? I know it's a bit of a loaded question, but.
Everybody comes to see me, she knows.
I know your opinion. I'm definitely not here to talk anyone out of doing any vaccines, because I am a naturopathic physician, but that does not necessarily mean that we don't vaccinate, or that we don't that we would advise against not vaccinating. So it's definitely a personal decision for the family, and so whenever we have a vaccine consult, it really depends on what both parents want, the child's potential exposures, like where they may live, if they're going to school or daycare or traveling or whatnot. But just overall, as a blanket statement for vaccines in a child who has a really hyperreactive immune system, is that could potentially send them into a flare, especially vaccines that are like live but inactive. That can trigger an immune response, and that is the goal of the vaccine, to trigger an immune response and produce antibodies, so that we run that risk that you could put them in a flare by doing that. So I usually like to say, not let's not do it, but let's wait until their immune system's more stable, just like you would not want to vaccinate a child who's sick because they run the risk of having a negative reaction. I usually say, like, let's wait until, you know, they're not like this all the time, but, you know, we've been stable for long enough where they're not having flares with every virus that goes around or every exposure. And then there's certainly, like, depending on the child, some vaccine prep that I would do just to prepare their immune system, make sure their gut's healthy, like keep their immune system calm, modulated, that kind of thing, so that we're getting the expected result, but not, you know, the big flare that you dread.
So I'm a family physician who has a grandson with PANDAS, just so you know where I fit in this situation. First of all, I don't believe there's been any association between vaccination and PANDAS. And really, if you're trying to prevent flares for these children, you're trying to have them avoid a multitude of illnesses, not only strep, but all kinds of viruses. So the theory being that having a flu shot, which will give them some protection from flu, influenza, should hopefully help prevent flares. And also to remember that even though PANDAS only has been diagnosed in the last 20 years, we've previously had rheumatic fever, which was somewhat of a variation of PANDAS, and certainly occurred in, and still occurs in third world countries where vaccination rate is low, and occurred before we had our current set of vaccinations. So at this point, we don't have anything to suggest there's any kind of relationship.
It's a really hot topic, and you knew it. It's a great question. No, it's a really good question.
I was never worried about the flu until a friend of mine died from it last year, and so now I am scared stiff.
So vaccines are like a wonderful invention, and people just don't get sick like they used to because vaccines are there. But what Dr. Wilson said is true too. Their job is to mount an immune response. So if you're in the midst of a very high immune response, I wouldn't want to give a child a vaccine during that time. Same way if you take a child to the family doctor and they're very ill, they're not going to give you the vaccine at that point. So it's a personal decision, but the vaccines can still be given when the child is as well as possible. And you can also follow, I mean, I'm not talking flu shots here, but I'm talking regular vaccine. There's nothing wrong with giving those vaccines a little bit later or a little bit slower. You're still giving them. And there's no like timeline that you have to get this in by such and such a day, because after that day, you know, the child's going to be exposed to pertussis. You know, you don't know that. But definitely it's supposed to mount an immune response, so I wouldn't give it to a child when they're in the midst of a huge flare of PANDAS.
Any questions in this section?
Hi there. Can you explain strep carrier? Like, what is that? With my son is 24 years old, and he's been showing PANDAS symptoms. It was a very quick onset. Got a strep fever within, I think, 10 days, 12 days afterwards. All hell broke loose. Like rages, tantrums, totally different person. Had his DMAS antibody test done. Thanks, Dr. Wilson, because you had that done. He was showing at 576, which was way over the under 300 mark. That's usually normal. Had it done twice, and it was the same amount, same highness. Never went down, and nobody can explain to me what that is. So do you have an explanation? Are the two linked, or is it two totally different things?
So I think the first part of the question was, what's a strep carrier? So we'll just start there. So a strep carrier is anyone who carries strep bacteria in their mouth on their tonsils, but are asymptomatic. So no sore throat, you know, they don't really come down with like strep throat. It's there, and we might swab them, and it comes up positive even though they have no symptoms. And I'm also talking about they also don't have psychiatric symptoms or tics or OCD or like PANDAS symptoms. And being a strep carrier is only really a problem in my books if you're either coming down with strep all the time, so if they're carrying it and then as soon as their immune function dips, they're getting it, you know, a few times a year, that's a problem. Or if you're living in a household with a child with PANDAS and you're constantly reinfecting the child. So that's why we might test close family members, relatives, that kind of thing, make sure they're not just spreading it back and forth. Regarding your son's titer, so that is not necessarily an indicator that he's a strep carrier in the sense that I was saying, like, you know, if you swabbed him, he may or may not have strep on his tonsils. But the high DNase B titer is a sign that his immune system is mounting an antibody response to strep. And the fact that you tested it and it was high, and then you tested it again and it was still high, I usually wait at least like 2 months between tests, so I'm not sure, 6 months, yeah. So 6 months would be like, the immune system hasn't mounted a response, dealt with the strep, and now the antibodies are falling. It just indicates to us that there's some constant immune production of antibodies towards strep. Whether that's something he's exposed to in the household, maybe he's just reacting to someone else who has strep, or he has strep elsewhere in his body, not necessarily on his tonsils. The gut can be a huge area for a strep. You know, we can't necessarily swab everywhere. So the titers will tell us, like, is that patient who's also presenting with PANDAS symptoms mounting a lot, like a high antibody response long term to this bacteria.
So Diane from Facebook asks, can PANS in young children present itself as autism? I think this might be a Dr. Edwards question.
Another really great question. I don't know the answer, but I have definitely questioned some of my younger patients who come to me with a diagnosis of autism. Because I do believe that when you change drastically, like you do with the PANDAS, a sudden onset, if that happens in your second year of life, between 1 and 2, it's harder to say, oh my gosh, this is a drastic change in my child. A lot of people will just say, well, you know, they're coming up to the terrible 2s, and that's why you're seeing rages now, and that's why you're seeing these things. So I don't know the answer to that, but I do question whether or not that is a possibility, and some of the children who have been diagnosed with autism, but more of a kind of a unique case of autism, maybe don't have that and actually could have PANDAS.
Autism as well, and part of my immune workup, just because of some of the things you were saying, is looking at infections that they may have had exposure to, strep, mycoplasma, sometimes tick-borne infections that can have impact on that child's system when they're in utero. So I'm always looking into that. It isn't always the case, but it's something to consider. And then I've also had kids who have a clear, like, you know, they're more of a clear case of autism, and they've had a diagnosis of autism, and you know, they were trucking along with just autistic symptoms, and then around age 7, 8, all of a sudden this new picture develops where they start ticking, and they also have like obsessions and compulsions, and the parents are like, this is, you know, a second onset of something new and something different. So with that, I'll obviously like look at you know, PANDAS triggers or PANDAS PANS triggers.
Oh, question.
Hi, my name is Erin. My daughter Brianna is a patient of Dr. Wilson, so she knows a little bit of our story already, but I wanted to get the opinion of the others as well. Our daughter got a sudden onset of a stutter when she was just over 2, and it came and went throughout a 2-year period, but always when she was sick. So we knew she's stuttering, she's gonna be sick, and the next day she'd wake up sick. And that happened for a few years, and then she had strep in February, and shortly after, sudden OCD. So the assumption that we think is that the stutter is related, but we're not. I haven't read a good explanation for how it would be a part of this, even though it seems to be related. Like they seem to come at the same time now. And I should add, the stutter is not, it's not like a repetition, so it doesn't sound like a tick, like an oral repetition. It's drawn out sounds or word blocks. So any insights would be appreciated.
That's actually really interesting because I have seen other children who get sick and will develop kind of one thing, and it's usually a vocal tick, maybe not a stutter, but over and over again. And yet that's as far as they go. So you certainly can't call that PANDAS at all, or even PANS. But it does make you wonder what's going on with the immune system. Does the immune system tend to attack somewhere in particular? It's also interesting because we absolutely have children who have tic disorders, and they're usually chronic childhood tic disorders, which means you have a vocal or a physical tic which waxes and wanes and waxes and wanes. And the key to that is that it waxes and wanes, not necessarily associated with illness, but definitely worse with illness or exhaustion or excitation. And it also changes. So the fact that your daughter had the same sort of thing with each illness doesn't quite fit with the definition of childhood tic disorder. The other part that's interesting is that she would do something like that over and over and be, relatively fine, get over it when the illness is over, but then eventually develop the PANDAS when strep sees her. And I've seen that quite a few times, and I don't know if that's just a predisposition because you obviously have an immune system that overreacts. I have no idea, but I've definitely seen that, for sure.
You've heightened my questioning too. From several of these questions, this lady was talking about vaccination, your question, and then question about PANS, PANDAS, and autism. Historically, you've heard a lot of parents who say their child was perfectly normal, and at either 15 months or 18 months they had their vaccination, and then there was this abrupt change in behavior and the child gets diagnosed with autism. And yet, study after study, and pretty definitively we now know that there is no relationship between the vaccinations and the MMR and autism. So then you question, were these episodes of PANDAS that were never diagnosed as such, they seem to occur after the vaccination, but it may have been that the timing just was coincidental, that the child came down with the virus. And it's just questions among the audience have made me think.
I don't believe that's coincidental. I think for those children who regress like that after a vaccine, something has happened. And I don't think you necessarily blame the vaccine, but I would definitely blame the reaction to the vaccine. So there are some children who, why doesn't everybody who gets strep come down with PANDAS? There's definitely people who have heightened immune responses. How can we identify those people ahead of time? And I think PANDAS, PANS, and maybe autism are somewhat related because of the immune system. Definitely autism, children with autism have abnormal immune systems. That's been proven over and over again. So they do often come down with episodes of PANS or PANDAS in the midst of their autism, for sure. But I do think there's that immune system, was something going on with your daughter's immune system, and each time she got sick, it was like another hit, another hit, another hit. And then she gets strep, and that puts her right into PANDAS. I don't know, but the immune system is an amazing thing, and nobody knows very much about it. I mean, they keep discovering new cells in the immune system. It used to be Th1, Th2, and Th3. Well, now there's a whole bunch more than that. So it's really something that we know very little about, but immunotherapy would probably be incredibly beneficial to a lot of us for a lot of diseases, not just PANS and autism.
Speaking of We had a question from Facebook about, sorry, I can't seem to find it, but it was about low-dose immunotherapy, and if any of you have tried it with PANDAS patients, and if you've had any success with that.
I don't use it, but I work with other naturopathic physicians who do. So I know a little bit about it. I can't really speak to that a lot. Maybe I should know more. Need more time. So basically, the low dose immunotherapy is like taking a very low dose of. So they have like LDI and LDA for strep, and they'll give you like a very, very low dose of that to your child to try and trigger your child's immune system to respond in low doses, like with microdosing, a little more normally to that, bacteria or antigen or whatever they're trying to do. So the premise is that it can settle down your immune system. I've only had a few kids who get it or have had it. Sometimes it sends them into a flare if they're really, if their immune system is really heightened, but perhaps there is some use for that, like just for the, in the long run of trying to modulate that patient's immune system. And the thing is, we can't, even if you homeschool, you can't keep your kid away from everything. So what we need to do is work on whether it's with LDA, LDI, or other immune modulators, how to make them less susceptible to being like triggered, up to level 10 whenever there's an exposure.
Peggy asks, what is the difference in kids who have had a break between flares and those who never have a break and just experience continuous symptoms? I think, Jen, you might have some thoughts on this, because your kids have experienced consistent.
In my experience, my oldest son has had actually recently a good breakthrough where he hasn't really had symptoms for quite some time, several months, which is brand new for him because approximately from the time he was diagnosed, he had symptoms almost nonstop. And my youngest child, he flares nonstop, which we kind of thought is allergy related. He has severe allergies, so his immune system is triggered by any allergen to him. But with him constantly flaring, it's a nightmare. He never gets a break. He rarely has good days. Whereas kids, like I see a lot of parents on our support group who talk about their children who go months at a time, who don't have any issues, or who have minimal issues, and then they have a really bad flare and everyone kind of falls apart and it's a nightmare for them. But that hasn't been my experience. So.
I think the more norm, well, maybe this is a bias because this is what I see in the office, but the more norm is to go with it and then slowly get better, not to be a mess completely well, a mess completely well. I think most kids who have this have it pretty significantly and it slowly goes away as opposed to it being an intermittent disorder.
I only have experience with my grandson, really, and through Dr. Edwards' help, he's been on a very, very low dose of antidepressant and anti-anxiety, and a very low dose antipsychotic, and for him, it has just made the world of difference. And he was diagnosed a year ago, but with this low dose anti-anxiety and antipsychotic, he is so well. And for him, that's been absolutely marvelous. He had one flare in the year and went back on the antibiotics for a month. And since then, so we've been reluctant to change anything.
I think that brings up a good point that the treatment for PANDAS can be threefold. The antibiotic is the one we're talking about the most here. But then you also can use usually very low doses of anti-anxiety agents because that's often one of the key features that's so hard for these kids to handle is the anxiety or the depression or the hallucinations. It can get really, really, really bad. So those medications will work centrally in the brain. They don't have that disorder. They have a feature of that disorder, so those meds can still help to a degree, but you're not committing them to those meds for their lifetime. You're not saying they have an anxiety disorder. You're using the meds for the effects that they'll have on their anxiety, and then you're going to take that away later. And then the third prong of the therapy would be like some sort of a cognitive behavioral thing, so that they can learn to self-soothe, because it's very, very scary to not be able to understand what's going on with yourself, to not be able to get unstuck from whatever it is you're in. So we try the three things. The antibiotics are kind of the medical end of things, and the antipsychotics or the anti-anxiety agents are like a band-aid for the situation that's happening to them in the kids who have that, and then the therapy to help them take some control back.
We had one in the back over here.
Hi there. I'm wondering what efforts are going into getting investigative protocols adopted in the standard of care in conventional medicine, so that these children get the benefit of a full investigative workup rather than being marginalized to the mental health care system. Who's doing this? Who is trying to make this happen? And the last part is, what biomarkers are being researched, or do we have anything yet other than the ASOT and antibody titers?
The first part of your question is the most frustrating part to answer. I don't know that anyone is really jumping on this. I have some remarkable parents who have approached tertiary care centers, who have pushed and shoved and asked for assistance and are getting turned away. We have brought Dr. Sweeto into town here. Dr. Sweeto was turned away from London Health Sciences Center, where she asked or offered to give grand rounds, and they did not want her there. She has given grand rounds at Sick Kids in Toronto. That was because of a parent, patient's mother, who pushed and pushed and pushed and got her in there. And shortly after that was done, it was taken down off the website, and it's not available to even be seen anymore. So I don't know how to do that. It's difficult. There are people, I have very supportive colleagues in this town who know what I'm doing and are supportive. I also have colleagues in this town who call me a crackpot. So I don't know what to say about that. I mean, as a couple of physicians, we can only do so much and say, we've seen it. I am so grateful to this woman who is a doctor and has seen it and knows that it really happens. But a lot of times, especially if you're a consultant pediatrician, somebody walks into your office with a child like this, and it's your first time seeing them, and they go, oh, it's just a kid with behaviors, it's just a kid with behaviors. But if you're the family physician who's known this child and seen them grown up and see this drastic change, that was my first case in town. A family doctor called me, and she said, I know this child, something is wrong. This is not this child. And that's how it got started for me. But I don't know how to make the powers that be start to believe that this is real. I'm sorry.
So I'm 40 years since I graduated from medical school, and of course I had never had any kind of training on this condition. And it was only through my research on the internet when I saw this drastic change in my grandson. Fortunately, when I talked to some of my younger colleagues, they had learned that this is a possible entity in medical school. So they knew a lot more than I knew. There is a clinic at Sick Kids that kids can get referred to. How can I put this? They have a clinic, but I don't think they believe in PANDAS. So it's a limited benefit, but it's a start. I was telling Dr. Edwards, I went to hear a lecturer, Alison McGeer, who's one of the chief infectious disease doctors in Ontario from Mount Sinai, talk specifically about invasive strep infection, and she didn't believe in PANDAS, and it's pretty upsetting.
We had a question over here. Tara?
They wanted to wave at Kay, and I had a question for them.
Come on here. Don't worry about the camera.
My name's Tara Luscombe. My son Ben is 7. He sees Dr. Wilson. I'm so soft-spoken sometimes. And my son is 7. His name is Ben. He sees Dr. Wilson. Dr. Edwards, we've been on the waiting list for quite a while. It was closed for 2 years, right at my son's onset. So I've known about you for a long time. It's nice to see you. My question was very similar. So I wanted to know what we can do. We've got a lot of people here who have had a lot of pain because of this. And we have a lot of people who want to do something. So that was pretty much my question, the same thing. What do we have to do to get people to help us? My son's onset was at 3, and he wasn't treated. I couldn't even get an antibiotic until he was 6. And he's lost all that time, and it's absolutely ridiculous, and it's unfair. And I heard you say you don't know what to do. And that's heartbreaking. It really is. That's it. I don't, my other question that I had was, what do you know, or how often do you see abnormal EEGs with kids with PANDAS? I've heard Dr. Sweeto talk about it a little bit, but I can never really find any research on that. Does anyone have anything?
I would say that of my patients who've had EEGs, that we don't often see abnormalities, which can be a good thing, but also frustrating because it doesn't give us any more information on what to do. But you know, oftentimes it depends if they're symptomatic of some type of neurologic issue or like seizuring activity in the brain, something that that we can detect on an EEG at the time that it's done. And if they're not, then you're going to get nothing. And that being said, like a lot of the patients I treat will have seizure-like activity where we, you know, it's not really the conventional seizure disorder, but there's something going on there. But again, you might not detect that unless it's actually occurring. So I don't see it often. Yeah. Do you?
Sorry, that was our final question that we can answer for now. Thank you all so much for coming down. I know that it was quite a trek for many of you. We have people watching from all around the world, which has been really wonderful. I hope that this hearing these doctors speak, and I hope that hearing the people's stories who you'll be seeing in the documentary tonight, I hope that hearing their stories will help you, and I hope that people will know that they're not alone by hearing them speak. We're going to have some of our producers speak to you. We're going to have representatives from the PANDAS community come speak to you. I'm just going to direct you all downstairs to the theater. Again, I just want to thank everyone for coming down and for everyone on our live stream. Thank you so much. Have a great night.